Welcome to Heart Failure The Basics. My name is Diana Smaglinski, and I'm a nurse educator for cardiology and CCU at the Ottawa Hospital General Campus. Today, I'll be talking to you about heart failure as part of the cardiac rehab series that's designed specifically for people living with this condition. We'll be reviewing some of the key things about managing your heart failure that you'll need to know. I hope you find this session helpful. Please note that the information that will be covered in this session is meant as an educational material and does not replace the professional medical advice of your healthcare provider. In addition, if you're watching this in Canada and you believe you're having a medical emergency, it's important for you to call your healthcare provider or dial 911 right away. As we review the information about heart failure, I'd encourage you to consider the following questions. These could be good topics to discuss with your healthcare team or with other people you meet who are living with heart failure. You can consider what was the biggest challenge you faced in managing your heart failure. What are some of the things you wish you'd been told when you were first diagnosed with heart failure? What are some of the resources and strategies you found that were valuable in helping you or your loved ones manage living with heart failure? These are the specific topics that I will be covering in this presentation. I'll identify the take-home messages that I hope you gain from the session, provide an overview of what heart failure means, discuss some of the main risk factors for heart disease and how you can impact your heart health by managing these risk factors. By the end of the session, you should be able to understand heart failure, recognize common signs and symptoms of heart failure, understand risk factors for heart disease and how you can manage some of these, and know what resources are available to you. We will start by reviewing what the term heart failure means. The heart's a muscle that works like a pump. Its main job is to pump blood throughout your body. Heart failure occurs when your heart is no longer strong enough to provide your body with all the blood and oxygen it needs. This happens because your heart has become damaged or weak. When this occurs, your heart must work harder than normal and does so less efficiently. This increased effort can cause physical changes in the heart over time. These changes can include enlargement of the heart and thickening of the ventricles, which are the heart's bottom chambers that pump out the blood. Please note, heart failure does not mean that your heart will suddenly stop working or that you're about to die. It simply means that your heart has to work harder than normal to keep blood flowing throughout the body. You will probably hear the term ejection fraction used by your medical team. Here's an easy way to understand that term. Your heart has two jobs, to relax and fill with blood, and then to squeeze and inject this blood out to the body. The percentage of blood that filled the heart that gets ejected when the heart pumps or squeezes is known as the ejection fraction. Ejection fraction is used to help determine what treatments will be effective for your heart failure. Some of the treatments that are effective for heart failure with a low ejection fraction are not as effective for heart failure that has a normal or preserved ejection fraction. Please note that it is possible to have heart failure with an ejection fraction that's a normal percentage. If the heart is okay at pushing blood out, but is not so good at filling with blood, it could eject a normal percentage, but there is less blood in the heart to be ejected, so the total amount of blood that gets pumped by the heart is less. Ejection fraction is used to make three categories of heart failure. Heart failure with a preserved ejection fraction, or HFpEF, is heart failure where the ejection fraction is 50% or above. At the other extreme, there's heart failure with a reduced ejection fraction, or HFrEF, and this is heart failure with an ejection fraction below 40%. In between these, you have heart failure with a mid-range ejection fraction, known as HFmEF, and that's heart failure where the LV ejection fraction, or left ventricular ejection fraction, ranges from 41 to 49%. There are different things that can cause heart failure. The most common cause of heart failure is having had a heart attack that damaged some of your heart muscle. If a lot of muscle is damaged by a heart attack, the heart becomes weak and the heart failure can occur. Heart failure is not the same thing as a heart attack. A heart attack happens when you have a reduced blood supply to the heart, and that causes some of its muscle to die. Heart failure can be a result of the heart attack if a lot of muscle is lost. This makes the heart less capable of moving blood out. Having heart valves that are leaky can cause blood to move in the opposite direction of normal, meaning the heart has to work harder to circulate blood. Heart valves that are normal, or which don't open well, make it more difficult for the heart to push blood through the valve, moving it forward in the body's circulation. Having uncontrolled high blood pressure for a long time can also lead to heart failure, because it means that the heart must push harder to circulate blood through constricted blood vessels. In a similar way, a heart that's beating very fast for a long time, as with certain rhythm problems, can cause the heart to work less efficiently and the heart will lose its normal function over time. Certain viruses can attack and damage the heart muscle, leading to heart failure. An excess intake of alcohol and certain types of medications, such as chemotherapy, can also cause damage to the heart muscle. Some people also have a condition called cardiomyopathy. This term comes from the Greek words cardio for heart and muscle problem, myopathy. This condition can result from the other causes I've mentioned, or it can occur for an unknown reason. When you have a heart with an abnormal or damaged muscle for any of these reasons, the heart must work harder to circulate blood, and this can cause heart failure. When your heart's not functioning normally, you may notice the following signs. You may feel tired and weak. You may experience shortness of breath that can happen with even mild activity or while you're lying down to sleep at night. You can have difficulty breathing that gets worse when you lie down flat. You may experience weight gain from fluid retention or have swelling in the legs, ankles, or stomach area. You can have different signs and symptoms of heart failure depending on what side of the heart is affected. Left-sided heart failure tends to cause trouble breathing, especially at night or when lying flat. It may also cause a dry cough, pale or grayish skin tone, and low blood pressure. The left side of the heart pumps blood out to the rest of the body. So when this side is failing, some of your organs can stop working properly because they're not getting enough blood flow. Left-sided heart failure is often related to hypertension or high blood pressure or a past heart attack. Right-sided heart failure tends to cause excessive swelling in the limbs, sometimes including firm abdominal swelling called ascites. Your organs become full of slow-moving blood, and this impacts the function of non-cardiac systems like your liver and digestion. The right side of the heart receives blood from the rest of the body and pumps it to the lungs to get oxygenated. For this reason, right-sided heart failure is often related to lung problems, or it can be caused by severe left-sided heart failure that has been going on for a long time. These issues can make it more difficult for the right side of the heart to pump blood to the lungs, and this can cause the right side of the heart to become weak over time. If there's a problem with one or more valves in the heart, it can affect blood flow in the side of the heart the valve is on. Worsening heart failure can also impact the ability of the valves to open and close properly. It's also possible to have heart failure that affects both ventricles. This is called biventricular failure. In these cases, you'll have a combination of signs and symptoms from both right and left-sided heart failure. Biventricular failure is often caused by conditions that affect the whole heart or its covering, or when severe left-sided failure causes the right side to fail too. Infections or inflammation can damage the muscle on both sides of the heart, and certain infiltrative diseases like amyloid, sarcoid, or Fabry's disease can also affect the tissue that make up the entire heart, causing biventricular failure. With any type of heart failure, fluid retention is the most common reason for patients to visit the emergency room. And in many cases, this fluid congestion is due to having too much sodium intake or drinking too much fluid. This is why it's important to monitor your daily weight. Day-to-day weight gain is not usually caused by calorie intake. It is normally caused by fluid. By measuring your weight each day, you'll be able to notice quick increases in weight that mean that you're retaining fluid. If you find your weight has increased, ask yourself whether your intake of sodium has been above the recommended level. Too much sodium in your diet will cause fluid buildup. This is because sodium acts like a sponge and it draws the fluid towards it, making it harder for your body to eliminate fluid. You can ask yourself whether your intake of fluid was above the level recommended for you. If fluid retention is becoming a problem, you may need to take a closer look at your fluid intake. Consider whether your urine output has decreased. If it has, your fluid recommendation may need to be reevaluated and perhaps decreased. This is something to discuss with your physician. If you do not already have a scale at home, it's strongly recommended that you buy one so that you can use it to monitor your weight every morning. Try to get one that's digital, with large numbers that are easy for you to see. When you weigh yourself, you're checking for quick increases in your weight that mean you are retaining fluid. If your weight increases more than 2 pounds, roughly 1 kilogram, in a day, or 5 pounds, approximately 2.2 kilograms in 1 week, this is a sign of increased fluid in your body. To help manage this, you might need to take a higher dose of your diuretic or water pill. Your doctor may have given you instructions about when to take an extra dose of this medication to manage excess fluid. If not, you'll need to call your doctor or your nurse to get specific instructions. While you were in hospital, you may have been provided with a copy of this weight tracker tool. If not, you can download and print a copy from the Ottawa Heart Institute's website. This is a guide for managing your heart failure by evaluating your weight and your symptoms each morning and responding to the signs when your heart failure is getting worse. At the top left is a place to write your weight when you first get home and check it out in the morning. This is your target weight. It's based on the weight you were at when you were sent home from the hospital after your heart failure has been treated. At the bottom left are instructions to follow to ensure that you're weighing yourself accurately. You should check your weight when you first wake up in the morning, after you empty your bladder, and before you eat or drink anything. Use the same scale every time and wear approximately the same amount of clothing. Lastly, please write your weight on the calendar provided so that you can identify changes that occur day to day or week to week. As you weigh yourself, think about how you're feeling. Ideally, you should see no weight gain, no chest pain, no swelling, no trouble breathing, and you should be able to manage your usual level of activities. These are signs that your heart failure is under control, and this means you're in the green zone. If your weight has increased by 2 pounds in 1 day, 5 pounds in 1 week, if you have shortness of breath, worsening cough, or if your breathing makes it hard to sleep at night, if you find yourself needing extra pillows to sleep, or you notice increased swelling in your body, or any other signs that worry you, these need to be addressed further by your physician. If you cannot reach them, call the Heart Institute Locating Department at 613-696-7000 and press 0 to ask to speak with the nursing coordinator with your concerns. These are signs of the yellow zone, and that means your heart failure is getting worse. If you're in the yellow zone, it's very important that you seek help at that time. If these signs of worsening heart failure are not addressed, they may progress and you may enter the red zone. The red zone means that you have a health emergency and need to be seen by your doctor right away. If this cannot be arranged, it's important to come to the emergency department. Signs that you're in the red zone include shortness of breath that doesn't go away even at rest, wheezing or tightness in your chest that happens even at rest, needing to sit in a chair to sleep, or feelings of confusion or being disoriented. If you're experiencing these things and your doctor can't see you right away, you need to come to the emergency department for further assessment. You should bring the weight tracker with you when you see your doctor so they can see how your weight has been since they saw you last. This will help them better understand how stable your heart failure has been. At the bottom right of the page are reminders for heart healthy living, including the need to understand your medications and take them as prescribed, the need to limit the salt in your diet and stick to your fluid restriction, and the importance of keeping active each day, working towards a target of 30 minutes of daily activity. Next, we'll cover some important risk factors to control to help optimize your heart health. Unfortunately, there are some risk factors for heart disease that we cannot change, including age, sex, ethnicity, and family history. Luckily, there are actually more risk factors for heart disease that can be modified, including smoking, high blood glucose levels, high blood pressure, overweight and obesity, poor nutrition, being physically inactive, having high levels of cholesterol, and having unmanaged stress or depression. I'll discuss some targets for the different risk factors. As these are reviewed, consider where you currently stand with each one and what areas you would like to work on. The Heart Institute's Cardiac Rehab program has a number of resources to help you reach your targets. First, if you smoke, I strongly encourage you to quit. If quitting seems impossible, try to start by reducing the amount that you smoke. Aim to be physically active at least 3 to 5 days per week, trying for activity sessions that are 20 to 30 minutes long at a time. Managing your blood pressure is very important. When you check it at home, it should be below 135/85. If it's being checked in a healthcare setting, it's often higher, but it still should not be above 140/90. For people who have diabetes, blood pressure targets are lower because diabetes is a major cardiac risk factor. People with diabetes should aim to have blood pressure less than 130/90, whether it's measured at home or by a healthcare professional. Living with anxiety and depression can be harmful to your heart. These conditions can be screened for using tools such as the GAD-7 and the PHQ-9. Scores of 5 or more on these tools can indicate that your anxiety or depression is serious enough to impact your heart health. Please talk to your healthcare team if you have any concerns about your mental well-being. Low-density lipoprotein, or LDL, is known as the bad cholesterol. For most people, levels of LDL in the blood should be below 5 millimoles per liter. For people with diabetes or who have had blockages in the coronary arteries, targets are much lower because their overall risk of heart disease is higher. In this case, the bad LDL cholesterol should be below 1.8. Triglycerides are a fatty, sugary molecule used to store extra calories in the blood. This can contribute to the buildup of plaques in the blood vessel walls. For this reason, triglyceride levels should be kept below 1.7 millimoles per liter for all people. Having a higher proportion of good cholesterol, known as HDL, compared to your overall cholesterol level can also be beneficial. This is measured using a ratio of total cholesterol to high-density lipoprotein, or healthy cholesterol. This ratio should be below 6 or below 4 for those with pre-existing coronary artery disease or diabetes. High levels of glucose in the blood can promote heart disease. A test called hemoglobin A1C can be used to check how blood sugar has been in the previous 2 to 3 months. Higher results mean that your blood glucose has been higher during this time. If you do not have diabetes, blood glucose should not be elevated, so this result should be below 6%. People who have diabetes will normally have higher levels of blood glucose, so the target for that population is somewhat higher, but it still should not be above 7%. When you have too much fluid in your body, it makes it harder for your heart to work and increases your symptoms of heart failure. Having too much fluid and/or sodium intake can cause this type of weight gain caused by excess fluid. Ideally, you should not notice any weight gain caused by fluid retention. You should not have any swelling, and you should not feel short of breath. Limiting your sodium intake to keep it below 2,000 milligrams per day is an effective way to control your heart failure symptoms. You should talk to your doctor to see if limiting your fluid intake is also necessary. These risk factors can each increase your risk of heart disease and heart failure. When there's more than one risk factor present, they can combine to increase your risk even further. We will now review these risk factors in greater detail. Smoking is a modifiable risk factor that damages the heart in many ways. It increases your LDL, or lousy cholesterol, while reducing levels of HDL, the healthy cholesterol. Smoking causes your heart to beat faster and increases your blood pressure, making your heart have to work harder. As a result, people who smoke are 2 to 4 times more likely to experience a heart attack compared to people who don't smoke. This is why it's so important to quit smoking, to improve your heart health. The Quit Smoking program at the Ottawa Heart Institute is one resource for doing this. You can also try using over-the-counter nicotine replacement medication, such as patches or gum, or you can talk to your healthcare team to discuss other options for becoming smoke-free. You will have noticed that the targets for many risk factors are stricter for people with diabetes. This is because diabetes is a powerful risk factor for heart disease. On its own, diabetes causes high levels of glucose in the blood, which encourages the buildup of fatty deposits on the walls of blood vessels. These deposits narrow the opening for blood to pass through the blood vessels, reducing the flow of blood to the heart and other tissues. This leads to heart disease. Diabetes also increases the likelihood that a person will have other risk factors, such as high blood pressure, obesity, or high cholesterol, which are also linked to heart disease. This is why diabetes is such an important risk factor to control. As I discussed earlier, hemoglobin A1C is a blood test that shows how high blood glucose has been in the previous 2 to 3 months. For people without diabetes, blood glucose is normally lower, so this value should be below 6%. Even with diabetes, which is expected to cause higher levels of blood glucose, hemoglobin A1C should not be higher than 7%. High blood pressure or hypertension causes damage to the lining of your arteries. This damage can lead to the buildup of fatty deposits on the walls of the arteries, which narrow the opening for blood to pass through. This reduction in blood flow contributes to heart disease. So we can see that it's very important to control blood pressure. For most people, blood pressure should be kept below 135/85 when checked at home, or below 140/90 when checked in the doctor's office, where stress can increase your blood pressure. With diabetes, these targets are lower because controlling blood pressure is especially important for people who live with diabetes. For this group, blood pressure should not be above 130/80, no matter where it's being tested. Cholesterol is a type of fat that circulates in the bloodstream. The bad or lousy LDL cholesterol is harmful because it's used to store cholesterol in the blood. When cholesterol builds up on the walls of blood vessels, it forms plaques, which can lead to heart disease. The good or healthy HDL cholesterol is helpful to have in higher levels. It counteracts the LDL by helping remove it from the bloodstream and excreting it from the body. For most people, the target for the unhealthy or lousy LDL cholesterol is below 5 millimoles per liter. If you have a history of diabetes or blockages in the coronary arteries, the target is much lower. LDL should be below 1.8 in that case. Triglycerides are another type of fat in the blood that promotes heart disease, similar to LDL. For all people, triglyceride levels should be below 1.7. As you can see, there are many things to consider in managing heart failure and optimizing your heart health. It takes a team, and the most important member of this team is you. Some ways that you can manage your heart health each day include monitoring your weight and symptoms each day, restricting foods that are high in sodium, keeping your fluid intake balanced, not too much fluid and not too little, and going to your follow-up appointments and calling your doctor when you find yourself in the yellow zone. Remaining active and doing your exercises will also help to improve your heart failure. When you were enrolled in the Rehab program, you would have met your cardiac rehab mentor. This is probably the person you first met with in the program. You will have regular follow-up contacts with this person to check how you're doing as you work through the program. These contacts are a good opportunity to discuss any questions you have that are specific to your case. You can also contact your mentor at any time if you have any questions. If you're unsure who your mentor is, please clarify this with the cardiac rehab department. The Heart Failure Patient Booklet and the Heart Healthy Living Guide are available on the Ottawa Heart Institute's website, along with the daily weight tracker tool we reviewed. There's also videos about heart healthy eating and living with heart failure. The Heart Failure Transitional Care Nurse is another excellent support. Let's revisit those discussion questions from the start of the presentation. Take a few moments to reflect on them and to recognize how much you've already learned to help manage your condition. It can be helpful to discuss what you've learned along the way and different supports you have found in talking with others who also have heart failure, we can learn a lot from each other's journeys. I want to thank you for taking the time to review this information. I hope that you've learned something new, and I wish you success as you take the steps towards improving your heart health. Thank you.